Hi folks, it's Boris Johnson here, and I just want to reach out to everybody who is, like me, forced to self-isolate. It's now, I think, about the 5th or 6th day since I've been put into isolation.
And the virus is spreading at an alarming rate in these areas. And I can't stress this enough. The situation is extremely, extremely serious.
We are facing a winter that's going to drive people inside more and more. And we're really at risk of seeing caseloads go up and hospitals get overwhelmed.
Remember that the right to shop is not as important as the right to life.
Meow! Huples cat, not Boris Johnson. So how dire is it? Well, I'm going to get into that. But it is a second wave. And for me, what I've been looking for to say it's a second wave is a distinct peak that's appearing in the global caseload, which we're definitely seeing. It's too easy, for example, in Canada to say, oh, this is a second wave, because we've had a huge bump in cases over the last 2 or 3 weeks. So for us, effectively, it is a second wave, a second surge of infection. But what's going on globally? Well, what's going on globally is a definitive peak. It's definitely rising hard, and it's definitely standing out from where we've been. Now that's interesting, because COVID-19 isn't acting like a general flu pandemic or the pandemics we've had before. What we've had before is 1, 2, 3, 4, 5, 6, 7 waves, but the background between the waves is almost zero. We have not seen that globally with COVID-19. What we've seen with COVID-19 is pronounced and regular infections, no matter what anybody does. Outbreaks even in China are continuing to happen from the community. Very tiny numbers, but they're continuing. And of course China just then slams down, quarantines an entire city of millions of people, and tests and tracks and traces all of them. So that's the kind of reaction that we're not seeing in the West. What we're seeing in the West is blame. We're seeing people blame for shopping too much, for partying too much.
I say to Manitobans, thank you to those of you who've been doing that, and to those of you who haven't, get on the team. Remember that the team is only as strong as its weakest link, and don't be the weakest link. Remember that the right to shop is not as important as the right to life. And we're bringing these difficult measures forward today to protect people and to save lives. And you have that power in your hands. So don't rush out to the stores and take advantage during the next few hours of the opportunity to hurt yourself and others. Please don't do that. And don't gather and protest without a mask on and endanger yourself and others. Do not do these things, because if you do, you will be ticketed and you will be fined. But more importantly, you will be placing yourself and others at risk.
We're seeing people being blamed for catching COVID-19. At my workplace, one of the ICU nurses has COVID-19. She's not doing bad, but again, you have to wait 7 to 10 days before you can say you're going to be okay with this type of an illness. But most people will be fine with it. But she caught it from a child who got it from school. And people are blaming her for coming to work before she was diagnosed, before the child was diagnosed. And that's a common thing. We like to blame other people for being less responsible, less intelligent, more stupid than we are, and yet when we catch things like this, it's not our fault, it's somebody else's. So it is not dire. There has been various people in various countries that are saying that our way of life is endangered by COVID-19. Clearly it is not.
This is frustrating, because I know we've all heard stories of people who've thrown up their hands and are not doing their part anymore. People who have stopped wearing masks, or people who are going out more than they should. And it's tempting for all of us to say, okay, well, maybe I can loosen up a bit more too. But the reality is, we need to go in the opposite direction. If there are people out there not following the rules when we know we need to, well, then those of us who need to are going to have to do even more. Because it's the future of our country. It's the future of our children. It's the future of our loved ones and our seniors. It's our economy. It's our businesses. It's everything all together. We're going to need to have to do this for another few weeks, for another few months, and we can begin to see the other side of this.
In Ontario, where I trust the figures, we've had an underreporting of figures by about 15% compared to baseline death rates. In other countries, they have really reduced their figures dramatically, and then when you find out the death rates, the baseline death rates, it's apparent they're suppressing about 30 to 35% of all deaths. Now this can be unconscious or conscious depending on how you define data. For example, if you catch COVID-19 in the United Kingdom and they fight really hard for 29 days to stop you from dying from it, and then you die, they're not listing you as a COVID-19 death because you died more than 28 days after catching it, after being diagnosed. It's an arbitrary thing, and it's different all across the world. What we do know is that Worldometer is now calling a death rate of around about 1% for new cases. And I just had a discussion with Kitty, my partner, who's an ICU nurse, and she said to me, well, the death rate's now only down to 1%. Look at Worldometer. Now the thing is, treatment isn't that much better than it was. It's marginally better. We do high oxygen, we don't ventilate as fast, and we're using Solumedrol. They're the treatments we have that are effective and widely available. We're not driving the death rate down from what was 6% in Ontario down to 1% by any magic means. What's happening is we have a dilution of death because the deaths are being stored up in the system because it takes a few weeks to a few months for the caseload to translate into hospitalizations, to translate into deaths. So even if it's 1%, that means 1 in 100 people who catch it die from it. They will probably be in a hospital. That translates into a tsunami of sick patients heading our way in Canada, and other places of the world have already experienced that tsunami. When that massive increase in demands for oxygen and ventilation occur, what happens is oxygen runs out and fails, surgeries are stopped, a whole bunch of things happen, staff get sick, a whole bunch of things happen, and the death rate from COVID-19 is then added to by death rates from other causation. You know, people we might have been able to save from COVID-19 when there's 10 patients in my hospital. If there's 100 or more, there would be no saving of them. Now the other thing is my neighbour came around today. He's going to help me put some siding back on the house. He's going to get me the tacks because he's going shopping this week. So he is going to go and get me the tacks I need, and I don't have to go shopping. That's networking. He said to me, but yeah, pretty much all of them are in nursing homes. That's not true. The percentage in nursing homes is currently about 60 to 70% of all fatalities. That translates into about a 0.3, best case 1% of Worldometer, which I do not agree with. That translates to 0.3 people like me and you catching COVID-19 and dying from it. What would that look like in terms of numbers? Well, it means for every 1,000 people that catch it, 3 people like you and me are going to die from it. So you can see if 10,000 people a day are catching it, you're looking at 30 normal, healthy people with great years of life ahead of them dying from it. That's why it's so serious. But again, I would say that the figure, if you look at the Johns Hopkins data, if you actually figure that data out, it's around about 2.5 to 2.6 death rate. So that's incredibly higher. Ontario's currently is about 3.5%, like I say, it dropped down from 6. Either way you cook this, whether it's 1%, 2%, 3%, that is a substantial number of people like me and you who will catch the disease and then die from the disease. We are not immune to it because of age. The younger you are, the healthier you are, the less likely you are to be one of the dead. There is no guarantee for anybody watching this who understands English, not because they're a foreigner, but because they're old enough to understand it, that you will not catch and die from COVID-19. However, the vast majority of people will have no symptoms, or in fact will have symptoms that are, quote, mild. But the people that have had this would not describe the symptoms as mild. Most of them feel very short of breath and very close to death for a period of hours to days. And it makes them quite humble. The problem is once they've had that, they then not quite so humble and they don't put enough focus into dealing with the disease. That's what we're in. We're in the second wave and it's dire. I'm going to do a second video. I did say months ago, don't stand out, don't demonstrate, keep your heads down. The governments of the world will flail and fail and they will get nasty. The people enforcing stay-at-home orders, the people enforcing mask orders, the people enforcing Anti-gathering orders are going to get increasingly aggressive, increasingly frightened, and increasingly tired. And that has definitely happened, but I think it's worthy of a second video because this is, in my opinion, the start of it. We are months away from a possible vaccination program that will give enough people the vaccine to actually make a dent in what is happening right now. Months. And that's not a guarantee. None of these vaccines may well yet work. We do not know. We will not know until we start mass vaccination. So it is dire in terms of hospitalization. But the other thing they keep rambling on about is flu. Historically, flu vaccines don't do a huge amount of good in terms of reducing hospitalizations from flu. So the statistics don't show mass vaccination has done very much, if anything, to reduce mortality or morbidity in any population. Historically, between October and December, January some places, we get hit by a lot of old people mostly, and some young, who have flu and need hospitalization and some ventilation, and then they die of it. This is a known phenomenon. It's why hospitals try to get flu beds ready for the flu season. Historically, a flu season that's going to be bad, coupled with the current pandemic, would make it dire for a few months. But the data does not support that. Australia is running at almost 0 flu cases, and they're finishing their winter. Japan, I believe, I haven't got the data, but I was told by a Japanese person, their flu incidence is 1/300th of normal currently. That's what I expect. People are wearing masks, washing hands, keeping social distances. They're not going to demonstrations for Trump or against Trump. Around the world, they're definitely not. And they're not doing risky things. On balance, the majority of people in all our countries have took a sane and stable view of COVID-19 and are doing what they can to avoid catching it and avoid passing it along. And the people deserve a huge degree of thanks. And yet what do we have? We have various politicians blaming the outbreaks on people shopping, people partying, people flouting the rules.
And we're bringing these difficult measures forward today to protect people and to save lives. And you have that power in your hands. So don't rush out to the stores and take advantage during the next few hours of the opportunity to hurt yourself and others. Please don't do that. And don't gather and protest without a mask on and endanger yourself and others. Do not do these things, because if you do, you will be ticketed and you will be fined. But more importantly, you will be placing yourself and others at risk. Manitoba's counting on you. Your friends, your neighbors, your loved ones are counting on you too.
None of them are blaming it on the actual driver. The actual driver for this second wave, in my opinion, in the West, is schools and colleges reopening. It was a huge error. All schools, all colleges should have been virtual only between September to September of next year. A gap year. And no, I don't believe that education should have been attempted for everybody, because a lot of children don't have internet, or they don't have a quiet place to study for 3 or 4, 5, 6 hours a day in their tiny apartment, especially during lockdown. A gap year. Let the children have the time off. Now, my suggestion that I raised to Kitty was that the teachers would then be redeployed and trained to be safety officers and screeners in hospitals and track and trace people. She didn't think the unions would like that, and she thought that'd be terrible. I don't know. I think this is a national emergency akin to World War II. People are still telling me, well, we haven't got the death rates of World War II. And they'll keep telling me that until we do. I do not believe that I need to put myself at risk of a 0.3% death. I think that's high. I think that's really significantly high. It's way higher than flu. It's way higher than car accidents. It's way higher than being shot in Toronto. So take it sanely, take it seriously. Don't put yourselves at risk. I'm going to do a separate video as well. So this, if you like, is a bit of an advertisement. I'm going to do a separate video showing how I clean my office when I arrive there, how I dress and undress getting out of the car, and how I have modified my lifestyle to try and avoid virus transmission. While it's true the virus can, in ideal circumstance, live 28 days on surfaces, it's highly unlikely to live 28 days on surfaces, and you're highly unlikely to eat it and it survive to get into your nasal passages to infect you. What you are likely to do is likely to go shopping, and you're quite likely, while you're shopping, to walk through clouds of virus coughed out by somebody else who's not wearing a mask properly. And if you're not wearing a mask properly, you might catch it. And if you are wearing a mask properly and you're unlucky, you might catch it. So avoiding being covered up, having a roof above you, avoiding crowds, wearing a mask at all times so you're close to any other human being outside of the people you normally live with in your house, providing they are not infected. So there we go to another thing. The advice continues to be ridiculous.
I know how frustrating it can be. So I just want to say to everybody else who is in my shoes, don't forget that, of course, the isolation doesn't necessarily apply to the people you share your home with. Your partner can still go out shopping or whatever. Your housemates can still go out to exercise. But you've got to make sure that you continue to observe social distancing from them. Your kids obviously can continue to go to school, but you've got to make sure you observe social distancing from them and follow the basics: hands, face, space.
As they said, if you are at home in quarantine because you have been in contact with somebody who's infected, the other people in your house don't need to be in quarantine. They should avoid you a little bit in the house, but they're fine to go out and about shopping and work. Again, if you really want to stop an airborne pandemic, if somebody who has been in contact with somebody who's infected, their entire bubble, their entire household should actually also go into shutdown quarantine. It only makes sense. If you've already infected them and they're wandering out and about in the public, that's not a great thing. So again, we're doing half measures, but the measures we're doing are aggressive. They're not targeting the schools. They're not targeting the colleges, and they need to. They're not targeting mass transit. There's been a few efforts on mass transit to do this, that and the other, but the bottom line is most buses and subway cars are sealed tubes, and it's not great. We needed to figure out 10 months into this how to cope with moving people around in a pandemic in ways that are safe. And I don't think we've managed to do that. Cleaning the cars down with bleach once a day or twice a day doesn't do anything. It's people inhaling breath from other people that's infecting other people with this type of an infectious disease. If it was a contact-only disease, we could do this. We could wear gloves, we could tell people not to touch the face, we could ask people to wash their hands getting on and off the bus. Because you know what? Most of the buses don't have hand sanitizer at the doors. We're 10 months into this. There's a whole bunch of stuff we could be doing we're not doing. And it's a state of decay. The governments are failing and flailing and blaming everybody but themselves.
So we need to do everything we can right now to slow the spread of COVID-19, to stop this spike in its tracks. If you were planning to see friends this weekend, maybe don't. If there was a birthday party or a gathering for dinner you were thinking about doing, don't do it. We're in a moment right now, or even with all the sacrifices I know Canadians have been making over these past 10 months, we are now going to have to really tighten up once again.
And the people enforcing what the rules are, where they are enforced, are getting more and more angry and more aggressive. And it's going to be weeks to months. It could be another year to another 2 years, worst case, if we don't get vaccines that are viable. People need to grasp that. This is not going away next month. This is not going away for Christmas. And if you want to have parties and you want to have people from all over your area come to your house for Christmas, don't. No matter what the governments are telling you, stay away from other people as much as you possibly reasonably can. There is no excuse for putting yourself in a position where you've got a 0.3% chance of death. I really don't want to do that. And that ignores long COVID, it ignores hospitalization, it ignores how unpleasant it is to have high flow oxygen or even ventilation and then survive anyway. There's a whole bunch of good reasons why the world needed to go on pause for 2020 and probably 2021.
Since the beginning of November, COVID-19 cases were identified on more than 40 domestic flights that flew in and out of YVR.
If everybody's being responsible and doing things the right way, then they should be allowed to move freely. But that being said, not everybody is like that. So, you know, sometimes we have to save ourselves from ourselves.
There's no excuse for this. It is really shopping versus lives. It's the economy versus lives. And anybody that wants the economy to function wants as hard as possible lockdown, wants the cases dropped as fast as possible, because that gives the majority of people the confidence to shop. People will not shop no matter what the government says, however open their society is, in a pandemic.
We can do this. We've done it before. We know what to do. We understand this virus much better than before. We need to reduce our contacts. We need to do it right now.
They didn't in 1918, 1919, and they certainly have not in 2020. The economic effects from this will be dire. Nobody's talking about that in governmental areas particularly, but the actual fallout from the economics of this will be dire, will be dramatic, will be society changing. I do not believe there'll be society ending, nor will COVID, but there will be major change in society because of the economic fallout from COVID-19. Once COVID-19 is gone, nobody's going to care about it. We probably won't talk about it very much. That's what happened with Spanish flu. People just basically wanted to forget about it. People started to spit again on the sidewalks. They had not been, they'd been very much encouraged not to do that during Spanish flu, but they resumed their normal ways. We will resume our normal ways once COVID is receding, and we won't talk about it very much. The chances of getting another 100-year pandemic should be another 100 years from now. However, climate change would suggest it might be sooner than that. For me, one of the major concerning points of COVID, other than avoiding catching it, is what happens if we get another coronavirus next year. Much like the common cold, which is a coronavirus. Coronaviruses that infect large numbers of the population can actually make the population more at risk from a similar but different expression of the coronavirus. They think this is what happened in Spanish flu. I believe it was Russian flu went around the world in 1916-17. Large numbers of people got it. Quite a few old people died from it. The young basically were fine. They think, they don't know, this is a hypothesis, it's a guess. They think that when Spanish flu appeared, the barriers that were there that had been set up because of the previous infection that had been easily fought off caused the huge reaction, caused the cytokinin cascade, which killed so many young people. So we're not out of the woods, we're not going to be out of the woods for a long time, but it's best we get over ourselves. You don't have to shop as much, you don't have to have pies, you don't have to go to the cinema, you don't have to eat out, you don't have to stand in line for anything. You don't have to go to a drive-through coffee store not wearing a mask and roll your window down and be served a coffee from some poor wage slave who's trying to wear a mask and hoping you're not infected. You can do reasonable things. You can reasonably protect others. You need to take caution. If you're on the sidewalk and you're able to, move away from it. If you're on the sidewalk and you can't move away from other people, talk to your local government angrily. They need to shut road traffic down in some of the cities, and certainly in the poorer areas of Toronto, shut down roads so people actually can walk safely. It's important that people get exercise. It's important that people get a sense of community out of this. Anyway, so I hope you enjoyed this. If you liked it, please feel free to subscribe me and give me a thumbs up if you wish to, but that's not that important. If you actually want to talk to me, feel free. I mostly catch people's comments. We can have a chat. I do believe that anybody that believes this is not a real pandemic is having a major denial of reality right now and having huge normalcy bias, and it's sad. So get over yourselves. Doodles.
I just have to tell the folks out there, it's important that I address the situation with COVID-19. We continue seeing extremely troubling numbers in Peel, Toronto, and York region. And the virus is spreading at an alarming rate in these areas. And I can't stress this enough. The situation is extremely serious. Right now, we're staring down the barrel of another lockdown in these regions. Because my friends, we need to hunker down, we need to stick together, and together we'll get through this.